It's World Meteorological Day, an annual observation led by the United Nations. It marks the 1950 establishment of the World Meteorological Organization. But more than that, it highlights the importance of meteorology in charting human action and development. We explore the science of predicting the weather in today's program. Welcome to Jamaica Magazine. I'm Audrey Williams. Local transmission of the Zika virus has been confirmed in Jamaica. So today we also look at the government's response to this public health threat, as well as the role of each citizen. The news is right after this quick break. Please stay with us.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Search for its breeding sites and destroy them. A message from the Ministry of Health.
Good day, I'm Andrea Chizom and this is your JIS News for Wednesday, March 23. The ceremonial opening of Parliament and the tabling of the 2016-2017 budget are set for Thursday, April 14. Cabinet ministers will meet ahead of that for a three-day retreat from March 30 to April 1.
Plan also to have preliminary cabinet consideration of the budget on April 4th and final consideration on April 11th.
The budget debate in the House of Representatives will follow, while the new estimates of expenditure should go to the Senate for its deliberation on May 27. In the meantime, Minister Reid says government will be tabling a carry-on budget of $83 billion during the next sitting of the House on March 29. It's to take care of the spending needs of the government until the next budget is presented. To get a better handle on Jamaica's Zika cases, the Health Ministry is moving to speedily test a backlog of samples that were sent to the Caribbean Public Health Agency CARFA lab in Trinidad. Health Minister Dr. Christopher Tufton told reporters yesterday that more than 300 samples were sent for testing and results were still outstanding for 145.
Most of the samples that are still outstanding are those that were sent to Trinidad. We, however, did keep a part of those samples here, and I've asked the technocrats to proceed to do our own testing of those samples that are in Trinidad, as well as the new samples that come in.
Those tests will be conducted at the recently upgraded virology lab at the University of the West Indies. There have so far been 5 confirmed cases of the Zika virus in Jamaica, 4 of them in Portmore St. Catherine and the 5th in License St. Thomas. Government is moving swiftly to intervene as the Chinese-owned Pan-Caribbean Sugar Company signals its intention to cease operations. While addressing the administration's first post-cabinet briefing on Tuesday, Information Minister Senator Ruel Reid indicated that the company was facing losses amounting to $60 million and would need a capital injection of $200 million. He said the matter had come to cabinet, which directed the relevant ministry to pursue negotiations for a sustainable business plan.
Not to take over the operation, but to seek to get other private sector interests to work together to make sure that this project and the production of cane takes place. And more so, we'd like to see that the matter of the cane industry is revitalized.
The Information Minister revealed that Cabinet was also paying attention to another matter of public interest, namely the recently announced toll rates for the North-South Highway.
We have heard the cries of the people of Jamaica in regards to asking for us to negotiate a better deal, and we are working very assiduously behind the scenes to see how we can address these concerns.
A new water treatment plant is to be built at Content Rio Cobre in St. Catherine. Cabinet has given approval for the $15 million contract, which is in keeping with government's 10-point plan for growth and development.
And we expect within 18 months, once this project has started, then we should see a significant improvement to the ongoing problems for the greater Kingston metropolitan area during times of drought.
The Rock River Primary School in Clarendon will soon have 2 additional classrooms equipped with computer terminals, laptops, multimedia projector, and more. This is courtesy of a donation from the Embassy of Japan under its grassroots human security project.
Japan's ongoing partnership with Jamaica demonstrates the commitment of my government to work with Jamaica to provide assistance and help where it is desired and needed most.
Education State Minister Floyd Green has expressed his ministry's thanks for the gift from the people of Japan.
We all must work together if we're serious about building the type of educational system that we can be proud of. I am happy today that Japan is partnering with us to assist in the development of students, teachers, and other stakeholders at the Rock River Primary School.
And finally, Prime Minister Andrew Holness and other members of his administration have condemned the terrorist attacks in the Belgian capital of Brussels. Bomb attacks in the capital yesterday claimed the lives of over 30 civilians and have left more than 200 others injured. Prime Minister Holness spoke with the Belgian ambassador to Jamaica and extended sympathies on behalf of the government and people of Jamaica. In a statement, the Prime Minister also insists that the international community must continue to speak with one voice, sending the unmistakable signal that these campaigns of terror will not break our spirit nor dampen our resilience as proponents of world peace. While expressing similar sentiments, Foreign Affairs Minister Senator Kamina Johnson-Smith says she has received confirmation that all Jamaican embassy staff and the 2 Jamaican students in Belgium are safe. There are an estimated 400 Jamaicans living in Belgium, and Minister Johnson-Smith says they have been offered assistance to contact loved ones in Jamaica if needed. And that's it for GIS News today. Amanda Chisholm, thank you for watching.
Now make diseases spread. Wash your hands with soap and water instead. Wash them regular or use a hand sanitizer. Make sure the germs them dead. Touching your eyes or your mouth or your nose. Wash your hands before you do things like those. After you use the bathroom before preparing food, come on, wash your hand them clean.
Over 60 cases of influenza A H1N1 and 5 confirmed cases of the Zika virus. In the face of those numbers, you're likely asking what the government has been doing to protect us. Well, we have the answers. In January, the Ministry of Health informed the country of the first confirmed case of the Zika virus in Jamaica. Shortly after, increased cases of influenza, particularly H1N1, was also confirmed. In response, action is being taken on several fronts to protect public health. Influenza or the flu is a viral respiratory illness usually resulting in symptoms such as fever, sore throat, cough, stuffy nose, headache, and body aches and fatigue. While most people generally get over the flu fairly quickly, it is estimated that over 56,000 persons die each year from influenza and pneumonia-associated complications. Here in Jamaica, the Health Ministry has confirmed a number of deaths associated with the influenza A H1N1 virus this year. To curtail those numbers, intervention was expanded and accelerated. As a first step, doctors were mandated to notify the ministry about suspected cases of severe acute respiratory infections, including H1N1, within 24 hours instead of the previous stipulation of 1 week.
And then we also sent out what we call a case report to remind physicians of what we're looking for and who would be a suspect case. So they don't need to be confirmed. If you suspect, we want to know within 24 hours.
The supply of flu vaccine has been beefed up, with frontline healthcare workers encouraged to take the shot. And looking to the next flu season, Health Minister Dr. Christopher Tufton has mandated that more flu vaccines be ordered to cover all healthcare workers as well as members of the population in the high-risk groups for severe complications.
And that would include the elderly, persons, women who are pregnant, children, and those with chronic illnesses like asthma, high blood pressure, diabetes.
Other interventions include preparing isolation areas in hospitals, procuring additional equipment, and increasing testing capacity for the H1N1 virus.
Additional supplies of Tamiflu used to treat H1N1 has also been acquired through the Health Ministry, while a new policy decision was taken to make the drug more widely available.
We wrote to the pharmaceutical importer. We asked them to bring in more to have it available in hospital pharmacies so that consultants would be able to prescribe this.
That decision was expanded to allow importation to private pharmacies.
Of course, you would need to have a prescription by a physician, and in the same breath, sending out the information to physicians around the country as to who we recommend should get Tamiflu. So we really don't want it to be everyone, or soon you'll have resistance being developed towards the product, you know.
Public education has also been a big part of the ministry's response mechanism, with constant messages urging persons to observe proper hygiene practices and take other measures to prevent infection. These include cleaning hands frequently with soap and water, covering one's mouth and nose when sneezing or coughing, avoid touching your eyes, nose, or mouth with dirty hands, and avoid contact with persons with flu-like symptoms.
So we really want to ensure persons get more serious about protecting themselves.
After confirming Jamaica's first case of the Zika virus, a number which has subsequently gone up and is expected to increase further, the Ministry of Health has been busy trying to eradicate the vector. As the virus is spread by the bite of an Aedes aegypti mosquito, the major thrust of the intervention has involved destroying mosquito breeding sites around places where people live and gather.
And so we increased our fogging in these areas especially, in addition to the routine fogging being done in all areas within the country.
A national cleanup campaign dubbed Operation Mosquito Search and Destroy was launched in Portmore and Spanish Town and has already been to Ocho Rios, with Mandeville next on the agenda.
Because fogging only kills 30% of adult Aedes aegypti mosquitoes. So we needed to get out to the public that it is the breeding sites that we need to destroy to not have more adults coming. You can't depend on fogging alone. In other words, this is far more than a Ministry of Health issue. It's about you and your home, your environs.
The ministry is also receiving help from local stakeholders as well as the Pan American Health Organization, with one of the biggest results being the upgrading of the University of the West Indies Virology Lab. That lab, which is a national influenza center, means Jamaica is now equipped to conduct local tests for the Zika virus.
The waiting period to determine infection has been significantly reduced.
Public education is also a big part of the ministry's Zika virus response program.
So what is it that we're asking you to do? We want you to make this a habit. Once a week, search for and destroy the breeding sites of the Aedes aegypti mosquito.
For more information on the influenza A, H1N1 virus or Zika, contact the Ministry of Health or the nearest health center.
So the government is doing its part to respond to the H1N1 and Zika threats. After the break, we show you the many places those pesky Aedes aegypti mosquitoes can hide in your homes, business places, and even worship centers.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Search for its breeding sites and destroy them. A message from the Ministry of Health.
It's not just Zika. The Aedes aegypti mosquito is also a carrier for chikungunya and dengue fever. All are being transmitted among the Jamaican population, and it will take all of us to stop the spread. Yesterday, we showed you the common breeding sites around the home. Today, we continue that focus while also showing that businesses and churches can also be havens for these disease carriers.
We're looking for any container or anything which can hold water. It doesn't need a lot of water for that mosquito to deposit its eggs. Very shallow quantity of water they can deposit in it.
The rain has fallen and this has collected water. And if it is allowed to sit in the environment for a couple of days, the Aedes aegypti will breed on it. This is a plastic over a pail, and the water is on the plastic. This is a beautiful breeding site for the Aedes aegypti mosquito. We have a similar one right here. There's water on the top of this container, and the Aedes aegypti mosquito will breed in it. Once the water begins to evaporate and she has a space to lay her eggs, she will lay her eggs, and this will then become a breeding site. Turn it over. We do appreciate that roof gutters are very necessary in some areas that do not have pipe water, so it helps to collect the rainwater when it comes. However, if these roof drains become blocked by trash or other things, then it makes the water stagnant and it becomes a major breeding site for the Aedes aegypti mosquito. So it's important, if you have these roof gutters, that you keep them clear, that the water is able to run. Even among your plants, we have plants that are, because of how the leaves overlap each other, they are able to collect water. And Aedes aegypti loves to breed in those environments. We suggest that persons do. If you think you love these plants and you want them, put them in pots. So when they do collect water, you're able to pick up the pots, drain them out, and put them down. Because as it is right now, it's very difficult for us to get rid of the water, and they will just continue to be in the environment as breeding sites.
This is a tire which has been discarded, but it's just in the backyard. And what we have now is apparently rainwater has now settled inside there, and we have it breeding. The Aedes are back to the breeding inside here. It can be used as an enclosure for your plants, like a potted plant situation. So what we'll show you now is how we can have it filled with dirt that will ensure that when rain does fall, mosquito will not breed in it.
There's also a method of stacking the tires so that they will not collect water. We advise the tire shop owners to, for each tire that they get, to punch a hole in each of the tires. Once that is done, they can stock them in this plaiting form. So they have one row going in a particular direction and then another set going in the opposite direction, and they will continue with this. What this does, it allows the water to be directed towards where the hole is bored. So even if the rain comes and water goes in, the water will not settle but go out. We know that most churches have what is called a baptismal pool. And we have found baptismal pools to be a major breeding site for the Aedes aegypti mosquito. So what is it that churches should do? We recommend that all baptismal pools be covered properly so that the mosquito will not have access to it for breeding. Sometimes the pools are shaped very funny, and so it's very difficult to cover. In those instances, we ask persons to empty the pool at least once per week. And after emptying the pool, we ask that you scrub the sides to ensure that you have dislodged all the eggs. So we saw many sites that were breeding the Aedes aegypti mosquito today. And we saw that these sites were found in and around our homes, business places. And if we do not deal with these breeding sites, they are going to continue to be there, posing a risk for the transmission of diseases because they are breeding the Aedes aegypti mosquito. So you must take action to rid your environment of those sites. So what is it that we're asking you to do? We want you to make this a habit. Once a week, search for and destroy the breeding sites of the Aedes aegypti mosquito.
Excess salt in your diet increases blood pressure and contributes to kidney damage, gastric cancer, obesity, osteoporosis, and the worsening of asthma. Aim to have no more than 3 to 6 grams of salt, or half of 1 teaspoon per day. And children under 11 years of age should consume less than this. Get healthy. Reduce the salt. A public service message from the Jamaica Information Service and the Ministry of Health.
Vitamins are substances that are found in foods we eat. Our body needs them to work properly. Each vitamin has a special role to play. For example, vitamin D in milk helps us develop strong bones and teeth. Vitamin A in carrots helps us to see at night. Vitamin C in oranges helps our bodies to heal from a cut. And B vitamins in leafy green vegetables help our bodies make protein and energy. There are two categories of vitamins, fat-soluble and water-soluble. Fat-soluble vitamins are the ones called A, D, E, and K.
When we eat foods that contain fat-soluble vitamins, the essential nutrients are stored in the fatty tissues of our bodies and our livers until our bodies need them.
The water-soluble vitamins are C and B complex. These cannot be stored in our bodies and will dissolve in water before our bodies can absorb them. Any vitamin C or B that our bodies do not use pass through our systems, mostly when we urinate. So they need to be replaced regularly to ensure a fresh supply every day.
But let's break it down and take a look at one of these vitamins, C.
Vitamin C is often referred to as the cold-fighting vitamin. It is also known as a wonder worker because it plays an important role in building and maintaining our tissues. Doctors say it can enhance the function of the immune system and plays a role in the formation of important enzymes in the body. Vitamin C is important because it protects the body from skin diseases, respiratory infections, and cardiovascular problems.
According to nutritionists, human beings cannot produce their own supply of vitamin C, so we have to obtain it through our diet.
Vitamin C is found in citrus and other fruits such as oranges, limes, lemons, tangerines, grapefruit, papaya, strawberries, melons, and cantaloupes. It can also be found in vegetables like tomatoes, broccoli, green and red bell peppers, potatoes, peas, raw lettuce, and cabbage.
Vitamin C can be lost easily during cooking, particularly frying, so it's recommended that people steam their vegetables to minimize loss.
Vitamin C is also good for preserving the body from aches, pains, and heart disease. If we do not have enough vitamin C in our systems, it could lead to health complications. Diseases or ailments may include gum bleeding, skin discoloration, lack of energy, tooth decay, poor wound healing, easy bruising, loss of appetite, and pain in the joints. According to medical experts, there are certain groups of persons who can easily use up ascorbic acid, that is, vitamin C found in citrus and green vegetables, more rapidly than others. These are alcohol consumers, smokers, diabetics, individuals under stressful conditions or fever, and the elderly.
It is important to remember that vitamin C is also a highly effective antioxidant.
For additional information on vitamin C, consult your doctor or nutritionist. You can also get valuable tips from any government health institution close to you. So be health-wise.
Pack the umbrella or shuck the heavy jacket? Book a tent or not? Simple questions, but the wrong answers could seriously disrupt our plans for any given day. Now think, if the question answered whether a farmer should plant or not, or determined whether people needed to evacuate their homes in the face of a storm or not. It's these kinds of questions that drive the work of meteorologists and their seemingly impossible task of predicting the weather.
Of course, all eyes are on Hurricane Ivan at this time, where we see that we are on the outer fringe of the system. Some of the bands are spilling some showers over the Jamaica area. Just a warning that this thing is actually coming across the area.
A television broadcast of national importance. A critical prediction that possibly saved lives and property. A prediction that came at the end of a process that began with some pretty sophisticated technology.
Weather forecasting is trying to determine the changes in the atmosphere.
Several methods are applied to gather weather data, from simple observation
It's critical to assess the clouds because the cloud is one of the most important elements of determining a forecast.
To the use of satellites, radars, buoys, and weather aircraft, forecasters from around the world share information generated by advanced computer software and remote sensing equipment, such as this automatic weather station. Working together, data is synchronized or matched, making it possible to predict the weather from virtually anywhere in the world. Weather collecting devices like buoys, which are equipped with special sensors and networked to computer software, are strategically placed and anchored along the seas or left to drift in response to ocean currents and winds. These networks of buoys provide forecasters with hourly updates on marine measurements related to wind conditions, barometric pressure, air and sea surface temperatures, as well as wave data. The Doppler radar is another useful tool. Radar stands for radio detection and ranging, and it works based on a series of principles named for Austrian physicist Johann Christian Doppler. This sophisticated instrument allows forecasters to monitor the speed and direction of severe weather systems. Data from all sources are fed to central points for analysis and comparison and are shared all over the world.
In doing that, we are able to produce what we call a synoptic chart. In producing this chart, it gives us a picture of what is happening across Jamaica and the region. Region here meaning the Caribbean area. After we do that, then we also look at what we call weather prediction models. These models enable us to determine what is going to happen in the future. What we do with the model is that we make an analysis of the model and we make a comparison between the model forecast and what we had done on the synoptic chart.
At this stage, a determination can be made as to what will happen over the next 12 to 24 hours with an outlook for up to 5 days.
In looking at the information, then we determine what the features are and what the influence of these features would be across Jamaica, which would indicate if the day is going to be cloudy, if it's going to be fair, or we expect showers, thunderstorm, or a very windy day.
From the more urgent situations, such as an approaching hurricane, to the less crucial, like where to go for a sunny vacation, news on the weather is always useful. And very important for fishermen and others who must navigate the seas for a living.
We also issue marine products, so persons who are going out to sea would know what the conditions will be across the seas. We have aviation products that are issued specifically to aviation users that would enable them to make a safe flight.
This is a live feed from the runway. So all the information that is displayed here is what's happening currently on the runway, and this is what is critical to all the airlines.
Information on climatic conditions is also provided to farmers and persons in construction, as well as those doing research on the environment. So the next time you see this,
some scattered shower activity over some coastal areas on the northern side of the island.
Remember, weather prediction isn't a guessing game. It's a scientific process involving sophisticated technology, providing useful information for industry, for research, for disaster management, and for life.
All residents immediately evacuate the area.
Unfortunately, we've come to the end of today's show. Fortunately, another is already being prepared for your viewing pleasure. So make the booking and be sure to join us when that magazine unfolds tomorrow. If you just can't get enough of this one, it's just a click away on our website or YouTube channel and link with us through our Twitter or email accounts. I'm Audrey Williams. Thanks for making it Jamaica Magazine.
This has been a production of the Jamaica Information Service, the voice of Jamaica.